Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Did you know that you can get calcium and bone nourishing minerals from drinking tea? Well, this is our topic today. And our special guest is Bonnie Rogers. And Bonnie is a clinical herbalist and wellness coach. And her mission is to help people nourish their bodies and eliminate their pain. And when working with clients, Bonnie puts together a custom plan of herbal medicine, food, and depending on the client, she may use some of her other tools. And one such tool is the Bemer, which helps improve blood flow, enabling her clients better absorption of all their nutrients. And in our talk today, we delve into teas to strengthen and nourish our bones. And Bonnie goes step by step into how to make a tea infusion and how we can get the maximum effects from our teas. She also talks about how we can use tea for anxiety, digestion, and better sleep. So stay tuned. Welcome, Bonnie. I am so excited to have you here talking about teas. This is a topic that could really impact our bone health, and it's something that most people don't know about. So I'm really glad I have an expert, and you're going to shed some light on this really great topic.
It's so important for people to know this information because it's such a simple way to make such a big impact for themselves.
And that's what I love. I love things that are simple but can have a big impact. So that's sort of one of the reasons I even started the podcast, because there's so much out there that people can do to help themselves, and a lot of things just aren't known. So I can't thank you enough for being here. And let's just dig right in. Let's just start with some things that people like. What are just some, we're talking about bone health and overall health as well too, but let's really look at bones. So what would be some simple herbs to use for bone health, and what methods do you recommend taking them?
So one of the things that I talk about with people are that you want to increase the minerals in your bones. And how do you get that? You know, some people talk about food. I really like to work with herbs. And there are lots of herbs out there. If you're taking herbs in a tincture form, do I have a tincture bottle? No. In the little dropper bottles, like you might take echinacea, there are no minerals in there. There's medicinal qualities, and that's wonderful. But if you want to increase your bone health, don't take a dropper of oat straw. Don't take a dropper of nettles, because it won't do anything. It'll do medicinal stuff for you, but it's not going to help with bone health. So when you talk about bone health, you need to use what I call overnight infusions, not a simple tea.
Okay, let's stop there. So really explain to us the difference between taking a tea bag and putting it in 5 to 10 minutes and the infusion.
So it really takes 4 to 8 hours or overnight to open up the cell wall in the herb to release the minerals. Because you really want your liquid to have all the minerals in it. Just like if you're making a bone broth. You're not eating the bones, but you want the minerals coming from the bones into your broth, and you're getting minerals that way. So that's another way. When someone's talking about food, they may talk about bone broth. Okay, so but what I do is I take a mason jar. So for people who are watching, I'm showing you. It's just a plain quart mason jar. And you can just put your herbs in there. You would take 1 cup of herbs, so whether they're oat straw or nettles, and we'll talk about these.
We'll go into that, yeah.
And then I love using this. It's a strainer for making cold coffee, and I think the name is Klein on Amazon. It's like $10, and I put this right in my jar. I put my herbs right in my jar, and then in the morning I take them out like this, and I have my tea. And
that's, it's very funny because I make infusions all the time, and I'm not as clever as that. You're gonna have to spell that
because it's a pain. Because then what you do is you have to take them in cheesecloth and squeeze them out. And this, I just take this. I take a spoon and I kind of push it down to get whatever liquid's left in there. And then
And
I
how do
compost
you
it.
spell it? How do you spell that? What is it? What it is?
Um,
We can put a link. We'll put a link
I
for
was
what it
just saying,
is.
I'll find
Yeah.
you the link, and you can put the link below this podcast so people
Yeah.
can go in and buy it. It's just on Amazon.
Okay, but
And
that's
it's a
great.
cold coffee strainer, and it fits in. I actually this morning when I did mine, I didn't do a quart. I did a half gallon, because if I do a half gallon, then it lasts me 2 or 3 days, and I keep it in the refrigerator and it's fine. And then what I do is I take my infusion and I heat it up and I put it in a thermos, and it sits on my desk and I just drink it. So
That's great.
I mean, the drink that I'm drinking right now is my mixture that I make for me, which is nettles, oat straw, red clover, and hawthorn berries. And we'll talk about why I chose those for myself. And I don't
Yeah.
always choose them for other people. It's what I use for most people. So let's talk a little bit about
Well, wait, before we
herbs.
do that, let's just talk about what you said, because this is so important.
Okay,
So now
so
I learned
you
something.
wanna
No, no.
do-
So my question is, so basically it sits out, because I know people always ask that. Well, where do you put it once you, so you have the jar, you put it in the jar.
So what I do, I'll explain, is I take a cup of the herbs, whether they're just one herb or a combination.
And let's stop there. So you buy the herbs, you'll buy the herbs in the form, not in tea bag form. You'll just buy the herbs in.
Right, the herbs come in a bag. I usually buy them a pound at a time.
Me too.
And you can buy them, I mean, you can go on Amazon. I always tell people, if you're going to buy herbs to use for an infusion, buy organic. You don't want to have the pesticides going into your body, because you want the best quality that you can get. So you can buy them on Frontier, you can buy them on Star West, you can buy them at Mountain Rose. There's a local place here in New York called Jean's Greens.
That's where I buy mine, Jean's Greens. Love
Right,
Jean's
and
Greens.
she's wonderful. Holly is a friend of mine. She owns the store and she's really knowledgeable. And so you can buy them at different places. You know, some are going to cost a little more, a little less. It's not going to make that much of a difference. I mean, as an herbalist, I have piles and piles of things because I have a whole apothecary. But you know, think about it. It's 16 ounces, and you're basically using 1 ounce is about 1 cup. So each bag that might cost you $10 or $20 is going to be good for 16 days. So you might use 2 bags a month. It's not going to cost that much. And what's the cost of your health to get these minerals in you? And so if you go into a store and you buy a nettles tea bag and you just dunk it, you're just getting flavored water. So you really want to use this as medicine. It's herbal medicine. It's not just herbal tea. So if you're taking, I recommend 2 to 4 cups a day. So I usually will finish this entire thing. So when I was on vacation last week, I brought my herbs in a Ziploc bag. I took a cup. I brought this with me. I put that in there. I put boiled water in it. And in the morning, I took this out. I took this. I poured it into my big plastic thing that I was bringing to the beach. And I drank the whole quart every morning. And I just did it every day. And I drank it cold. So you may like it cold better. You make it like it iced. I like it both ways. In the summer, I drink it cold. In the winter, I love it warm because I just like things warm in the winter.
So once we put it, so once they, okay, so you put it, you put it, and I love that because I strain it. So this is so much easier. I'm buying this.
So much easier.
I am ordering this immediately because I use a strainer and then, and I strain the tea out, but this is way, way easier. So once you do that, then how long do you leave it out before then you would put it in the refrigerator?
So what I do is I take my boiled water, or I have Instant Hot, so it's just under boiled. So I'll actually use the Instant Hot because it's one less thing for me to do. Fill up my jar, cap it. So one of the things I want to tell you is that when you do this and you fill up your jar with your herb, you put your herbs in, you fill your jar up to the top, leave it open, don't cover it for 5 minutes. Go back and top it off, because what's going to happen is the herbs are going to suck up the water, but you're going to probably have about a ½ inch of air at the top. Top it off, because you don't want the air taking the medicine. You want your water, that's what you're going to be drinking, to take all the. Top it off, put your cover on it, leave it on your counter, minimum 4 hours. I leave it overnight. In the morning, I take the strainer out, take the herbs out, or just squeeze the herbs if you don't want to buy, the strainer, and take that jar and put it in the refrigerator, because these are high protein herbs. And just like if you left meat on your counter, you're going to get mold.
So the longest you would leave it then? What's the absolute
refrigerator?
longest? No, not the refrigerator. Let's go back. The longest you would leave it on your counter. You put it overnight.
12, 15 hours.
Okay. So then right after that, you put it right in the
I put it in the refrigerator. Or a lot of times I take that whole jar and I pour it into a saucepan. I heat it up and I throw it into my thermos. And if you were going to an office, I would take the thermos right with me to my office and I'd drink it during the day.
Oh, that's
then
great.
It would be done.
And one thing to tell everyone, and I'm sure you agree with me, do not go to your office and heat it up in the microwave.
No microwaves. Microwaves change the molecular structure, and then you don't know what you're really getting.
Exactly.
No microwaves. I always tell people, heat your stuff up on the stove in a saucepan.
I agree. And then
it takes 2 minutes. It's not a big deal. You can take it cold, and you can drink it cold, because it doesn't matter if it's cold or hot. It's about drinking the minerals. And when you get the minerals in your body knows what to do with it. Your body knows how to assimilate. As long as you have good digestion, you've got good blood flow and circulation, your body knows what to do with these minerals. And our tendons, our ligaments, and our bones need minerals so that they're flexible and fluid, and so that you can move through life being flexible.
Absolutely. So this is really helpful. But the interesting part then, when you go to the health food store, you're in the supermarket, all these teas say bone health or relaxation or this and that. So what you're saying
because they might be good for bone health, but they don't tell you how to use it. So oat straw.
Yeah, let's go into, okay, but my point to you is then I just want to make sure that we're all understanding.
Mm-hmm.
What you're saying is that if you put it in for 10 minutes, you're really not getting benefit.
Yeah. Minimum 4 hours.
Okay.
It's just leaving it on your kitchen counter. It's not a
And what happens if you take that tea bag and leave it 4 hours? Would that be?
This is not enough. In a tea bag is about 1 teaspoon.
Yeah.
And I'm telling you to use a whole cup.
Okay.
For a quart. So you're using basically a 1/4 cup of herbs for every cup that you're drinking.
Okay. So why don't we get into, because it's interesting, why don't you, when you get into the specific herb, I'll tell you some things that I read that really point out to exactly what you're saying. So let's start with what your favorites for the bones.
My favorite for bones is oat straw.
Okay.
You could get oat straw, you could get milky oat tops. It doesn't really matter. What I love about it is it builds fluidity, it builds flexibility, it helps to build bones. It has a ton of calcium and all kinds of other minerals in there. Not only does it build bone, it helps to relax you. It helps to relax you, it helps with anxiety, and it helps with sleep. I'm not saying that if you drink only oat straw, you're just going to sleep all night long, and there's other things I might do.
You know what, let's get into that after the bones, because I think that's sleep's a big issue here. But I think that's good to say that that's relaxing.
So that's one thing that if you're going to choose an herb, you might as well choose one that's going to do multiple things.
Exactly.
So oat straw is one that I love. Nettles, I use all the time. Nettles is great for energy. It's great, tons and tons of minerals. If you're collecting it because you have it out near you, and you only want to collect the springtime nettles for your tea, because the ones that are older that have flowers on them, there's too much silica in them, and silica is like glass shards. So you always want to just collect the early spring ones. You can buy them, that you're going to get the early spring ones.
Oh, okay. So there's not something that when we're buying nettles, you
hope that it's somebody who's going to be harvesting them ethically.
Okay. So that's why it's so important that you choose a real reliable, good source to purchase your teas from. Okay.
Yeah. Another one who has really good herbs is healing spirits.
Oh, okay,
Healing
great.
spirits, herbs, something. You can, Andrea and Matthias are the owners of that, and they have wonderful quality.
Oh,
Also.
okay, great.
So oat straw, nettles.
Let's stop with nettles. Can we stop with nettles for a second? Because I was doing research when I was putting together my osteoporosis course that I teach, my online course, and it was because I really like to know what ways people can get calcium, you know, how they can get calcium. And it was so fascinating because exactly what you said, that when people just put like 5 to 10 minutes of nettles, they got 5 to 10 milligrams of calcium. However, when they use a whole cup of nettles infusion, just exactly how you talked about it, up to 500 milligrams of calcium. Isn't that incredible?
What a difference.
So the point is, and I looked, different sources told me anywhere between 300 to 500 milligrams of calcium when you have a whole cup of nettles infusion. That's incredible. What a great source that I don't think people
and instead of taking a pill that's not necessarily absorbed into your body of calcium. Now remember that calcium, if you take a piece of chalk, it's total calcium. Think about how you can crack a piece of chalk. We don't want our bones to crack. We want our bones to be flexible and fluid. So we need all those other minerals that you get when you're using an herb versus a pill that's just going to be straight calcium.
Yeah, this is
and you don't only need calcium and magnesium, you need all the other minerals that work in conjunction.
Absolutely.
And that's why this makes such a great impact on people's bone health.
Right. So the other thing with nettles that I found is sort of, as you said, it stimulates you. So it wakes you up. It really gives you energy. So sometimes if I want to be neutral, if I don't want to be, I don't want to be, and the oat straw relax you. So a lot of times I'll mix I'll have both, the oat straw mixed with the nettles because they sort of cancel each other out, you know, in terms of one being relaxing, one being stiff. That's what I found myself. But, you know, and again, sometimes you want to relax. Sometimes you really want that extra energy. But nettles is amazing, and there's so many good benefits for the bones. So.
And when I do just nettles infusion by itself, to me it's a little too strong or green, and I like a lot of green. So that's why I love to mix my herbs together.
Great.
Because it makes them more palatable. Because I think your herbal medicine needs to taste good. Because if it doesn't taste good, you're not going to use it.
Right. You want to enjoy your tea, and then you can find teas that taste good. So you
don't want to put sugar in it.
No. So you'll enlighten us to that, what you find, and how many, like if you're putting that cup in for the quart jar, what's the most, like how many different varieties would you put? Is there a limit?
I mean, like I say, I mix red clover, oat straw, nettles, and I put hawthorn berries in, and I'll tell you why. For some people, and I might add some horsetail if I know somebody really needs lots of bone growth, but not a lot of horsetail. So
yeah, let's go. You want to hit horsetail now? Let's hit horsetail.
Horsetail has probably more minerals than any other medicinal herb does, but it also has a lot of silica. And like I said before, silica is like glass shards, so you don't want to use a lot of it. I recommend adding 1 tablespoon to that cup of herbs that you add. You'll see people will add up to a 1/4 cup, which is 4 tablespoons. So I think 1 to 2 tablespoons is enough.
And is it okay
to add that additional?
Is it okay? I've heard that horsetail is great. The silica is good for your bones. It helps with the flexibility, but you can't have it every day. Right. That's what I've heard, not to have it every day.
No. So, I mean, maybe a couple times a week, add 1 to 2 tablespoons of horsetail in. But
there's also some precautions. Right. There's some precautions. If people, I mean, I know they say people who are pregnant shouldn't have horsetail. Is that what you recommend? Or if anyone has any issues with their kidneys, that's an issue with horsetail.
Because think about it, it's glass shards. They're literally like glass shards, is what silica is.
And so where it's very good for the bones, but not in a limited amount.
Small amount. So maybe do 3 times a week, do a tablespoon of horsetail. I don't want to scare you because it's nothing to be scared of, but just be cautious. You know?
And also make sure, no, don't be scared because it's good for you. But also sometimes you could feel, right? I know that I've read if you feel any pain near the kidneys, or if you have any symptoms, or if you notice anything different, then you would cut back.
Yeah. And I think I mean, there are certain things that you can have every day for the rest of your life. Oat straw, nettles, red clover. Some people like having red raspberry. For me, it's too astringent. So it's almost like having a lemon in my mouth. It's very astringent.
Can you hit can we talk about red clover? Why don't we go? Okay.
Yep. So red clover is wonderful, and you've probably all seen it growing. It's like the white clover that we see on all of our lawns. The red clover is just a little bit bigger. It's red. When I harvest it myself, it's beautiful, and it dries beautiful. Red clover is great for building lots of minerals in your body. However, if you have had a breast cancer, especially estrogen sensitive breast cancer, red clover has a ton of isoflavones in them, just like soy does. And if you're avoiding soy, I recommend people who have had estrogen sensitive breast cancer don't add red clover into their tea, because we don't want to mess with anything. You know, who knows? I mean, there are some herbalists that tell you that you can use it. I like to err on the side of caution. And so I'm going to say to you, don't use it. If you want to use it externally, I've been known to use red clover poultices on a breast cancer lump or something like that. But then I may probably going to use regular traditional medicine for that, because, you know, it's a both and thing. It's not necessarily this or that.
Right. And I agree with you. You might as well err on the side of caution. There's just no reason to.
And it tastes good. It makes your tea taste delicious. It's sweet. I mean, if you took a red clover next spring and you see it next June and you take it and you taste it, it's delicious. It's sweet. I'll sometimes take a red clover and just pull the petals off and throw them over a salad. It's delicious. And it tastes great in your tea.
Oh, that's great. Are there any other things so that you would put I know we could go on.
I like to put hawthorn berries in mine. So hawthorn berries also make it taste sweet. And so hawthorn berries aren't specific for bones, but they're good for like blood pressure, whether it's high blood pressure or low blood pressure. It's an equalizer.
Yeah, they're really great for the heart, right?
It's great for the heart. It's the happy thing. It also has a protection. So when you think about any kind of a rose plant, so hawthorn is part of the rose family, or rose bushes, and they have thorns on them, they're meant to be protective. So whenever I make tinctures out of hawthorn berries, I put a thorn in it for the energetic magic of hawthorn berries.
Oh, that's so interesting.
Because I want to protect the heart energetically also. But I also want to have it, so when I make my mix, it's not all about bone health. It's about energy. It's about the nervous system. It's about red clover is good for the lymphatic system. It's good for the reproductive system. It's good for digestion. The hawthorn is good for happiness. It's good for your heart. And I'm looking to get something that I'm drinking every day that's going to be a big balancer for every part of my body.
Oh, this sounds great. I'm going to add, I've used the red clover. I've used the nettles and the oat straw.
A little handful, maybe 1 to 2 tablespoons I put in there.
Of the what?
Of the berries.
Okay.
Berries.
I'm definitely
not a lot, but it just, you know, it's always so funny when you think about it. Like my husband doesn't like nettles. That's one of these tastes he doesn't like. But for him, and he uses his stuff more for anxiety. He's got a high pressure job. And he'll be like, "Oh my God, you need to make me something."
He's pretty spoiled, right? He has the expert in the house.
I mean, I'll make him oat straw, lemon balm, red clover, and hawthorn berries.
So is that good? Because anxiety is a big issue, and also stress increases cortisol, which reduces the bone building cells. So it all ties in. So for someone who wants what would you say for a good mix for reducing anxiety?
I would add a little lemon balm in there. Lemon balm is good for your digestion, and it's really good for your entire body in terms of anxiety.
Okay, great. So you'd have oat straw, lemon balm, and anything else.
And clover if you want, or I just always add a little bit of hawthorn berries because they can't hurt and they taste delicious. Okay,
great. And is there anything I know a lot of people listening have sleep issues. Any of your favorite for sleep issues?
So one of the things, my favorite thing to use for sleep is skullcap, which is Scutellaria lateriflora, not the bicalensis. Bicalensis is just a totally different thing. So it's if you look at the Latin, it's called Scutellaria lateriflora, And I use it in tincture. And what it does is it turns off the mind movies. So think about it. You go to sleep and you're exhausted, and you put your head on the pillow and you think about your client you worked on today, and you think about what's going on with your family and what's doing this. And 3 o'clock in the morning, you're still awake. So what Skull Cap does is it stops that. If I have in my dresser, which I don't use very much right now, I used to have to use it every day. I have a little tincture bottle on my night table, and my husband will go, "How do you know that's Skull Cap?" I go, "Because it's the only tincture bottle I have in my night table." I just have a sip of water, which I always have next to my bed, and I'll just squirt a dropper in my mouth, and I'm sleeping in 5 minutes.
So right before bed, you take the Skull Cap?
Yeah. Right before bed, it works like in a few moments. Some people like to use passion flower, which does the same thing. For me, I don't find it as effective. And a lot of times when I send clients home with sleep stuff, I might send them home with a separate bottle of each and say, try one, and if it doesn't work, try the other.
And is there certain brands?
Not every herb works for everybody.
Is there certain brands that you buy, or you make them? You actually?
So I make them myself, but when you buy Skull Cap, you want to make it, you'll see, like if you look on Amazon, you'll see some is made from dried herb and some is made from fresh herb. You want the one that's made from fresh herb. I want to say that Gaia is a good one.
Oh, okay.
And Herbalist and Alchemist, which is my favorite, but Herbalist and Alchemist you won't find on Amazon. You can go on their website. It's herbalist-alchemist.com. That's David Winston's company, and that's who I studied.
You know what I'll do? I'll put some links. I'll put some links to the good companies that people can. I'll send you the links to the companies.
Okay,
fantastic. That's great.
And so Skull Cap is a great one, and you just do 1 dropper. For someone who's really have a hard time, California poppy, also in tincture form, but you can also use linden tea. So people can buy linden. It's also known as tilia or lime flower. Tilia is the Latin. And most of my clients will say, Bonnie, you tell me to make a cup, and this is a simple cup of tea. So this is, you put a teaspoon in the cup or in a little tea ball, and you put hot water on there in 3 or 5 minutes, start to drink it. Most of them will say, if I put it next to my bed, I don't finish the tea because I'm sleeping.
That's incredible. Wow.
So linden is great for falling asleep.
Wow. And what about if someone wakes up in the middle of the night? Do you recommend tea at that point, or?
I would just take a dropper of Skull Cap or California poppy. California poppy, you have to realize, may make you, it's more of a sedative, and it may make you loopy in the morning.
Oh, okay.
So Skull Cap doesn't make you loopy in the morning. I take a whole dropper, but I have a client of mine who only takes 6 drops. She says that's enough for her. She doesn't need any more than that. She'll say to me, Bonnie, why do you need a whole dropper of it? And motherwort. Do you know about motherwort? It's not for bone health, but it's for anxiety. It's for some people, it's about sleep. It stops heart palpitations, and it just makes you feel better. It's like mother's little helper.
And that's also in tincture form?
In tincture form, and it's bitter, so you wouldn't take a lot of it. And for people that have anxiety attacks, I tell them to keep a little bottle in their pocketbook, because they can take a couple of drops if they're having starting having an anxiety attack, and it'll stop it.
Wow, isn't that incredible? That's something so simple. Where you don't.
Motherwort, if you look at the plant, motherwort, the flowers are right in the base of where the leaves come out, and they have this what's called a calyx. And if you touch it with your fingers, it freaking sticks to you. Excuse my language. And it's like you have splinters in you, so you have to be really careful. But think about it energetically, it's protecting your body from all these things that might be coming in and attacking you energetically.
Wow, that's fabulous. Wow, this is just so incredibly helpful. Are there any other teas that you want to? I mean, I know you could go on and on. We just want to highlight.
Yeah. So one of the things that I don't use that much for bone health. Actually, I have it in here. I was thinking to myself, what did I really put in this yesterday? I added some holy basil into it.
Oh.
So holy basil is an adaptogen. So what's an adaptogen? An adaptogen makes your body adapt to stress. So it doesn't work on a specific organ per se, like I might say oat straw works on bones or nerves. Holy basil helps you relax. It helps you deal with life. I have a friend whose daughter was going to PT school at Columbia, which was very intense program, and she is a type A person, and she said to me, Bonnie, what can I do? I am so overwhelmed. And I had her do Tulsi, which is holy basil.
Oh, yeah.
You can see it, organic India sells it. You can get it on Amazon. You can get it in some health food stores. And it would keep her on an even keel.
So I have a question about that.
Mm-hmm.
So I love holy basil. It's something that I use as a tea bag. However, what about, you don't need that as an infusion then? That's something you can just...
No, it's a quick tea, but I actually threw a handful into, I made a whole big jar of my tea mix because it's easier to have it in my kitchen than to come down into my office and pick and choose what I want that day. I'll create like a big jar for a week or so. And so I actually added, and I just felt like I needed a little bit of an adaptogen in there.
So the holy basil, so though if we're not worried about absorbing the minerals, then we can do the steeping for 10 minutes and that's fine. So the main purpose that we are doing these infusions is so that we absorb all those incredible minerals. Okay.
Right, and my favorite tea bag of the holy basil is from Organic India, and it's a combination of holy basil, cinnamon, and rose.
Oh, I've had that. I love that. Yes.
And it's delicious. And I just keep pouring more hot water over it. I'll just use one tea bag for the whole day. And so it's got the cinnamon, which is going to help with your blood sugar, the rose, which is going to help make you feel better, just give you a little bit of lift. And it tastes really good, but I've never seen it in a health food store. I just get it on
oh, then I'm thinking, and then maybe I haven't had the right thing. I'm thinking
you might have had with rose, but not necessarily the cinnamon, unless the stores near you buy it. I mean, it's an individual, whoever's ordering.
Okay, because I get different flavors of the holy basil. I love
that. Like they have peppermint. They have it's a nice thing to keep like one or two of those tea bags in your pocketbook, like when you go somewhere and all they're gonna have is unorganic tea, so you can get hot water and throw a tea bag in.
Right, that's one of the things I do, bring my own. Because you can be at a restaurant and they hand you Liptons, or just.
Right, so I mean, I always have that in my bag, and I always have a glass straw because I like using a straw, and I won't use plastic straws. And everybody looks at me like I have 3 heads, and I will go, this is my straw. Don't worry about it. It's
our health, and who cares what anybody thinks? That's always my philosophy. I never care. Where do you store these? One other question for you. In terms of the tea, so it comes in plastic bags. Do you move those? Where do you store your tea?
Well, I have big glass containers that I have an entire apothecary of shelves in my office wall. So I have big jars. But I recommend that you take them out of the plastic and you can put them in a big mason jar. You can put them in a regular glass jar, and you could take all those bags that you get and make your own mix and just throw it into a jar and bring it into a cabinet in your kitchen so it's convenient. Make sure this is all convenient, because if it's not convenient, it's not going to happen.
And how long do you think they last? Like, how long do you feel they'll be good?
I usually recommend dry herbs. Okay, year, maybe a year and a half, but
okay, good. I'm sitting here.
You can only harvest them for a couple of months each year, okay? So they're going to have to last a whole year till the next time you can harvest them if you're going to be doing your own harvest. So if you're buying them, I mean, and they're buying from all different places sometimes. You look at it and they're buying it from Turkey and they're buying from someplace else. And so you want to make sure you're buying organic. You want to make sure that it's fresh. And you can call them and you can ask them the dates of the herbs.
Okay, but that's good that there's a long shelf life, because I was thinking I sometimes keep mine, like a year sometimes. Usually not, because I do use
hopefully you're using them, because if you're not using them, then they're sitting there.
Yeah, I would buy very big quantities. When I see patients, a lot of times I'll bring them in. I'll make like a little tea and bring it in so they can taste it before they go and purchase it. And so they hear what the infusion tastes like.
I teach some continuing education classes, and I always have tea, and they're not always about herbs. They might be about some other thing that I'm dealing with, but they always get tea. I always have my thermos. I always have my paper cups for them, and I'll start out by saying, I'm Bonnie Rogers. I'm an herbalist and a health coach, and whenever you take a class from me, you're going to get tea. So. And they just kind of like look at me like I have 3 heads. And
I love this.
I don't want to drink it, don't drink it.
So I think since we could talk about this forever, but you also do have something else really interesting that really, I don't know anyone else that does this. So I think we're going to switch gears a drop from the tea, unless there's something else you want to talk about with the tea. But I was going to ask you to just talk about the Bemer for a minute. But is there anything else on the tea you want to?
Yeah, there's a couple of small things I wanted to mention.
Okay, sure.
So there are also herbs that are bitter, and so those are things like dandelion or burdock. But I recommend that you take bitters a lot of times before you eating, so that not only does your food get absorbed better, your herbs get absorbed better. Because what these bitters do, and they could be a bitter herb. So like Urban Moonshine has some really good herb bitters. I love the Herbalist and Alchemist bitters. I mean, they're not going to taste delicious. They're bitter. You can also take a piece of radicchio and chew on it. What it does is it tells the pituitary that there's food coming and they should release more digestive enzymes. And so bitters are a really good thing to know just in terms of herbal medicine and getting things absorbed into your body. And dandelion and burdock, I might take dandelion root and just throw it a little bit into my mix that's going to sit overnight, because it just gives it a little bit of bitterness, and it's a good thing for women's hormones. It's good for clearing the liver. This is not our topic today.
No, but I think it's important because digestion is key when it comes to your bones. And some people, it also helps with the bile. It helps excrete bile, the bitters, which a lot of people, if they don't have their gallbladder's not functioning. So
also as we get older, our body produces less and less bile. And so we need to help it. So there are some people that will give digestive enzymes, and that's okay. I rather teach the body to produce more by using bitters.
And how much earlier would you say before your meal? Like right before you'll have the bitters?
5 minutes. 5 minutes.
No, that's great.
Especially if we're going out for dinner, my husband will say, "Did you bring the bitters with you?" I'm like, "Well, yeah, they're usually in my bag." Because if he's eating like a heavy steak meal, he feels much better if he has a little bitters beforehand.
And when you're talking about this, are you talking the tincture bitters? Or how
tinctures.
Are you talking? In tinctures, okay.
Tinctures.
Okay, so it's not having dandelion tea, it's having it in a tincture form.
Yeah.
Okay.
Yeah, and not even a lot. It could be 5 drops. I mean, you put a little bit in there, and it's bitter.
But it really does. I agree with you. It makes a huge difference. And
of how you don't feel bloated. You don't feel, like you're not bloated. You don't feel like your body's making all kinds of noises. It's not able to digest as well. And a lot of that stuff is that your food is stuck in your stomach and it's not moving through because it's not alkalinizing enough, because that's what those digestive enzymes are doing.
Yeah. Okay, that's great. That's such a important tip, and how wonderful that we can use herbs to do that. So that's great.
And so one of the things that you started mentioning is, so one of the tools that I use for my clients and for myself is a product called Bemer. And it's what I call a magic mat. It looks like the size of a yoga mat. And you sit on it 8 minutes twice a day, and it increases blood flow by 30% in your microcirculation. So think about bones. That's microcirculation. If you don't get in those little capillaries and the microcapillaries, that's the way you're going to get nutrition into your bones, into your ligaments, into your tendons. For me, as soon as I started using the Bemer, I started to sleep all night long without using my skull cap. And I thought, oh my God, this is crazy. Like, I'm falling asleep like my husband. I'm sleeping all night long, and I'm not even getting up to go to the bathroom. And if I do, I'm going right back to sleep. And that was not the case. I was doing what I call that 2 to 4 a.m. menopause dance crap. and for me, I sleep all night long, and why is that so important? Because you wake up and you feel like you have energy. You don't wake up feeling tired and sluggish. And I also know that these herbs that are coming into my teas are now really being integrated into my cells.
So you're saying it's going to increase the absorption?
Absolutely.
It's really interesting, because it's something that I want to learn more about, because I had a patient who had really, really bad back problems, like serious back problems for years and years and years. And it was just something she sort of accepted. And she also could not lose weight. And she had come to me for osteoporosis, and she was doing, she was doing okay with that. However, and I after I was finished, I hadn't seen her in years. And then she called me and wanted to come in for something. And I didn't recognize her. She had lost all this weight. She was glowing. And she said, and she no longer had the back pain. And she said she was just raving about the Bemer. So it's definitely something I want to explore more and look at the studies, because it's certainly something that has major potential. And
so the whole thing in terms of studies, this is the deal. It's a medical device in Europe. It's in 4,000 hospitals. If you look at the European stuff, you'll get studies.
Great.
The problem that we have in the United States is it's a class 1 medical device in the United States. It's not a class 2. So class 2 is where you can say it cures this, it cures that, it does this. I can't tell you that. I can tell you stories of people. I mean, I remember when I first got this, and my husband's in really good shape, but if he was sitting down, he'd put his hands on his knees and he'd go 1, 2, 3 to get up, and I'd be like, oh my God, you sound like your mother, stop it. And he sat on it literally once a day for 10 days, and I shut my mouth instead of being that naggy wife. And I noticed that he was just getting up and there was no complaints. And I was like, okay. And one of my students was here one day, and she was on the Bemer, and he has his computer in that room. And she says, are you using this? And he says, yeah. She says, what are you noticing? He says, my hips don't hurt me anymore. I was in the hallway and I'm like, yes.
Wow.
And so it increases the blood flow. If you can increase the blood flow, you can get fluidity in there. You can get more nutrients in there. And why does it, I have, with bones. So I have a client whose son is a football player at a high school, and he injured himself. He injured not just the meniscus, but both cruciates, and he had to have surgery, special surgery. And he was playing on the football team after extensive testing 6.5 months later.
Wow.
As a physical therapist, do you know that that's really fast?
That's really fast, yeah.
And she had gotten her Bemer a week before this happened. After a year of telling me she's going to get it, it was like the universe told her she needed to get it right then, because he used it from day one when it happened, even before the surgery.
That is incredible, Bonnie. And how people can use that. I know, for example, you're a practitioner, so people can go to your office and have it, versus they don't have to buy it.
That's right.
Right. So, but you said you have some information on that we can.
I do. So one of the links that you're going to see below here is a link that's going to say mustsee.com and some numbers. And what it is, it's an interactive presentation. So it might say, are you an athlete? Do you want more information as an athlete? Do you need more sleep? Do you need more energy? And you can go and look at the entire presentation, or you can look at what you want. And it's an interactive presentation. And my phone number will be listed on there somewhere if you have questions for me. Feel free to reach out, and I'm happy to talk to you about what I've seen, what I've experienced. I've seen people with asthma. I've seen people with all kinds of stuff. It's just
really incredible. It's something that I want to. That's why I love this podcast, because I want to bring things to people's attention, because you never know who's listening and who that might be. Oh, you know what? I'm going to test that out. Exactly. You just don't know. So I just wanted you to talk about that. I'm going to do more research on that myself, because I think that there's so many people that I think could benefit from that. So that's on my list. But this has been. So is there anything else you want to? I will have your website. You want to tell everybody what your website is too?
My website is bonniesherbals.com.
Okay, and that will be in the show notes.
Yeah, that'll be in the show notes. And so it talks about what I do. I do coaching. I do consults, and I have products that I work with that you can see that are on there that have nothing to do with bone health.
Great. That's great, because you have done so many great things. So this has been anything else you want to enlighten us to before we end?
Not at this point. Really, in terms of bone health, obviously there's all kinds of other things in terms of exercise and movement, and think about fluidity. Are you somebody who is stuck in your life and is not flexible? If you're not flexible, remember this, that your bones won't be flexible at all. Your energetics affect your body. So breathe a little more, use these herbs, let them create some fluidity and flexibility in your life so that your bones can get the same thing.
I love that. That's just such a wonderful way to end. And now we have some great resources. This has been so helpful, because you really put it that we can go back and do these teas. It's not something that we have to, oh my goodness, how do we do this? It's easy. It's something simple, especially now if we get that other thing that's easier.
Right, and I'm going to create a PDF that you'll be able to put out there that's going to have a list of these herbs and how you can use them and what you can do, just so you can have something to look back at and not have to re-listen to this every time.
Oh, that's so great. Thank you so much. That would be so very helpful. Well,
I'll have that to you in a day or so.
I can't thank you enough. I'm so glad that we connected and met, and I look forward to staying in touch.
Sounds good.
Okay, thanks
for
so
having
much.
me. This was wonderful.
Bye-bye. Thank you.
Bye.
I hope you've enjoyed today's interview with Bonnie Rogers as much as I have. I know I learned a lot, and I hope you now have a better understanding of how you can utilize tea, tinctures to improve your bones and overall health. All of the links we talked about are in the show notes. So goodbye for now, and look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.